Okay, healthcare and disability part two. Here in part two, it's going to be a bit more brief. We're going to look at predominantly social development and health, so a more global perspective on health, in particular looking at the approaches to healthcare. We'll look at the healthcare system in Canada. We have a rather unique perspective on it in Canada, but it doesn't generally move out across the world. So we're going to see what it looks like, what are the conditions and the parameters of it, and then we're going to look at healthcare issues in the future and what might be some of the effects that we'll see about some of the health issues and disabilities in that future. What might be some of the prospects that you might be considering in this chapter? What would you know? Would you know what is the state of healthcare in Canada today? Now, it began, I think, in around about the 1957. It'll be in the video later on here. And it's changed over time. What is the state of Canadian healthcare system today, and how might it be improved? There are certainly people who are not being as affected by the changes, and there are others who are dramatically being affected by the changes to the healthcare system. So we have been pushing towards changes that would include more people rather than excluding people, but the creation of a two-tiered system, those who have access to the quality and those who have access but less quality, is certainly something that many Canadians fear might happen. All right, so let's get started with part two. Let's look at social development and health and the more global perspective. When we look at the difference between developing nations and developed nations, we see these differences. Mostly due to, in the developed nations, we have good nutrition, good medication, we have more equality, and all of this helps towards having a better social development and health. Whereas in developing nations, we'll find some differences that we might see as being fairly traditional differences, if you will. One of the things that came through in the first part and is repeated here when we see this over countries, health and wealth are connected. You have money, you have a country of money, you're going to have access to better resources and therefore better health. And sort of look at the differences here. We're just seeing essentially health countries. Now if you look at the graph that's made available for you for your assignment, you'll see those differences, that basically health and wealth are correlated. This is a reminder that on the positive side, infant mortality rates have decreased from 1990 to the year 2000 across the board. We've seen this in developed countries certainly, but in more developing countries we see immunization, oral rehydration therapy for diarrhea, and iodized salt to save as many as 5 million children. Age expectancy rates have risen. So what's important, and this is a reminder, this is from a slide that's in week 7, looking at life expectancy to help you understand how that's determined. When we talk about an increase as many as 5 million children surviving, one of the questions that Hans Rosling had sort of inquired then and sort of did a video on, and I would encourage you to find that and view it as well, is what if we have more children staying healthy? Does that not increase the population and put the population of the world at risk? And he did a great video on that to sort of show how the data does not support that. So one of the things that's hugely different across the world is the access, and it's a huge difference, access to clean water. Clean water makes a huge difference on so many different levels for so many different people around the world. We need to protect our clean water better than we often do in this world today. So when we think in terms of our healthcare in Canada, from 1995, these events have occurred. Budget cuts to healthcare, reduced medical student enrollment, reduced nursing student enrollment with layoffs. The opinion polls in Canada that many Canadians believe that their health care has been jeopardized. You can find this in figure 11.2 on page 275 of your textbook. Now, universal health care is one of which all citizens receive medical services paid for through tax revenue. Now, this emerged
from Premier Tommy Douglas from Saskatchewan in 1947 to cover hospital costs. That's Tommy Douglas there. In 1962, the program was extended to cover physician costs, not just hospital costs. By 1972, both programs were extended to all of Canada. Universal healthcare elements that provide that provinces must meet, and these are those 5 conditions right here: universality, comprehensiveness, accessibility, portability, and public administration. And so it's important in our healthcare in Canada as of 1972, this is something that all provinces were to adhere to. Well, there's a problem with the universal healthcare. There's been drastic cuts that have undermined the system. Overutilization of the system, much waste, the duplication of services across the provinces and across Canada has had a huge impact on costs of healthcare. Long waiting lists. Some are advocating for private healthcare that would result in more of a 2-tier system. And a 2-tier system really just means that having the rich be able to afford one quality of care and the poor being able to afford another. The United States, for example, the only industrialized country which does not have a healthcare system that provides universal coverage for all of its citizens. And if you've been watching and listening to the U.S. Election and with Trump's presidency, you've noticed that this is a big issue in the United States around the reversing of Obamacare or the Affordable Care Act. And in fact, in the United States, 60% of the population doesn't know that those are the same thing. The Affordable Care Act and the Obamacare are exactly the same thing. They are the same thing. And so their coverage is about to take a big, huge dive. Most citizens in the United States have to pay for private coverage. About 15% of the population has no coverage whatsoever. Canadians are healthier than Americans and have better access to healthcare system. So we should do what we can to preserve what we've got as well as we can. If we look at the different approaches to healthcare, there's 3 of them that are referenced in your textbook, and I'm going to give you a quick overview on each one. You can find more information in your textbook, please. One is the medical model of illness, and there's some assumptions about illness. One, that the deviation is from the normal. It's specific and universal. There's biological causes. There's an analogy to a broken machine. If you're ill, there's something wrong with your parts. And defined and treated through science. And this is the medical model. It looks at illness. It doesn't look at health. And that's an important distinction. If we go to this, a second, which is more the technology in medicine and what it has done, we can alter our bodies for cosmetic or aesthetic purposes. Alter our nose. We can do so much cosmetic work, reducing fat, increasing fat, reducing breast size, increasing breast size. We can do so many things cosmetically. It begins to put into question who are we and what makes us who we are. The creation of cyborgs, part human, part machine. They started the thinking back when pacemakers and these are pieces that are put into our body to help our heart keep pace. Or the artificial hearts, the Jarvik. This is the first artificial heart that replaced our own personal heart with a machine. There's certainly other examples. The essence of life in the brain is the brain. Technology has been able to look at the brain and see the brain in action, and looking at maybe the sense of self is in the brain, and so it's brought into question whether the brain is the only important part of where the soul and self is. There's an example of a Russian doctor who has got an individual who has agreed to have a head transplant. Where does technology stop, and where do we stop the use of technology? The external womb, conception and gestation outside the womb. I'm trying to think of her name. I've lost it, but there was a young lady who was the first test tube baby in England. I believe it was in 1982, I think. She has 2 children of her own, but she was born outside the womb, if you will. She was conceived outside the womb. And all sorts of examples of new reproductive and genetic technologies that impact the way that we view health and view one another and our abilities to take advantage of technologies for medicine. And then lastly, we can touch base and look at the alternative approach. And this is where we're starting to move in Canada a bit, is looking at some alternative means by which to reach out and help citizens, promote more preventative medicine, responsibilities to individuals and families, more community-based care, holistic, examples of using other professionals, social factors influencing. So in healthcare in Canada, we're seeing a variety of ways in which we could start to explore how we can improve the overall benefit of what the healthcare system in Canada can do. Now lastly, but not leastly, we'll look at the future. Continued movement to prevention and community care. We're going to see more and more of that happen. As the population ages, there will be greater demand on the system, and we're seeing that beginning already. Need of the government to support move to community-based care, yet with burdens on caregivers by doing so. There's great pressure for privatizing the system and a continued presence of social factors causing illness. In a global perspective, we'll see renewed concerns for sexually transmitted diseases and HIV and AIDS. New concerns for SARS and mad cow disease and the growth of the avian influenza, an epidemic among domestic birds from Asia that may spread to humans. West Nile viruses. We'll see more issues regarding viruses than we've seen in the past. Okay, on that happy note, we're ending part 2 of health, healthcare, and disability.